Week 8 explores community safety and wellness with Professor Leah Montange.
My plan for the evening is to start with just some reflection and writing individually about these questions, and then we can talk about it as a group after you take some time to write. Then I'm going to do kind of a mini lecture about public safety and reimagining public safety in light of increasing lack of confidence in police and their ability to provide public safety. And then I have some definitions that we'll go over, some brainstorming that we'll do, and then I have an activity for us. So that's the plan tonight. Okay? I have, well, not I, but Kayla has put out paper and pens, so I'm gonna make sure you get one. There you go.
Do you want to sit away?
No, I got my own wheelchair.
Well, I mean,
Just move the phone in it. Okay, so the idea is to start just by reflecting like what makes you feel safe in your life. It could be anything from your pet dog to or cat to your family, the people who you can rely on, the resources you can rely on, whatever makes you feel safe. So we'll start there. Yeah. Are you okay? We have a safety concern over here. Yeah. So
I was just trying to choke it.
So you'll start with like you as an individual, and then you'll go to thinking about your neighborhood as a whole. What would make your neighborhood feel more safe? Yeah. And then you'll think about not just safety, but like if there's a real crisis happening. Where do you go? What do you do? Where can you get help? Where can you rely on to get help? So there's paper and pens so that you can write, but if you really prefer not to write and you prefer just to think about it, that's okay too. We're done? Okay. While I wrote, I reflected on something that happened to me in my neighborhood in August, which was I live in a high-rise that's off of Bloor and Dover Court. And it's an old high-rise. It was built in the 60s. And in late August, there was an explosion in the electrical room in the high-rise. And so I was on the 9th floor. The explosion was on the 1st floor, but we could hear it, you know? And then the lights went out and the fire alarm started going off. And we have lived somewhere before where there was a fire, so we knew exactly what to do. We put the cats in their carriers, and we got the passports and the laptop, you know, and put that in the bag. And then we had time to grab underpants and cat food, you know, and then we went outside. And many people from the building were outside. Most people had not packed their go bag, whatever. That's okay. But immediately we're starting to get in touch with people who we know who are in our neighborhood to see if they can either let us, you know, stay at their home for a few hours or maybe overnight and figure out what to do. And so while it's not possible to live in a perfectly safe situation, one of the things that made me feel more safe was that I actually had a plan, a loose plan. You know, I hadn't written it down or something like very anxious and anal like that, but I had an idea of what to do, and then I also knew who to reach out to, you know. So that's what I was thinking about while I also was, what makes me feel safe? My bed, you know, just, you know, having a home that I can take care of, you know. But anyway, I'm curious what makes you all feel safe and what you think would make your neighborhood feel more safe. Yeah, I mean, this is the part where I was gonna just talk at you a little bit. And I noticed, first of all, that when you talked about what made you feel safe, it was mostly home or having a wider sense of belonging outside of your home even. It was predictability and feeling oriented, right? Like you know where your kids are, you know where you are, you know what's gonna happen next. Those are the things that help us feel safe, and those are kind of our basic needs. People seem to like having a safety, emergency safety net that you can call on, right? If there is something really unsafe happening, So for some people that was their community. In some cases it would be the hospital or 911 or the police, depending on the situation. There's this idea that circulates more and more in Toronto, in other cities in North America, that calling on the police can make a problem worse instead of better. And I don't know if people have ever seen that in their lives. I have a story, not my personal story, this is the story of someone I know named Jay, who gave me permission to share it. But this is someone who was a veteran, and he had lost his eyesight as a soldier. And so he wasn't a soldier anymore. And he was living in it wasn't a public housing neighborhood, but it was like an affordable housing unit for people with disabilities. And his next door neighbor and him were in a pretty severe conflict with one another. And his next door neighbor was constantly harassing him with racial slurs. And Jay is a African American or a black man. And he had talked to his therapist about it. He was getting support, and his strategy was to turn up the music in his home to drown out the sound of the person who's harassing him. And the person who was harassing them then escalated and called the police with a nuisance complaint against Jay. And Jay didn't answer the door when the police knocked, and they just went away. And then the cycle repeated again. And Jay also received physical threats from his neighbor. So they're in a conflict, and it's escalating, right? The police are called again. This time they knock. Jay is not aware that it's the police, and he answers the door with the knife in his hand because he thinks it's his neighbor, and he thinks that he has to show that he's not going to be bullied, right? The police are not aware that he is blind and that he can't see, and they do not announce themselves. So what happens is Jay ends up getting in a fight with the police, So we all know where that goes, right? We don't all know where that goes. One of the ways that could go is that Jay could get shot. The reason he didn't get shot is because there were two police officers there, and Jay was standing in between them. So they didn't want to shoot their partner. And that's what they testified in court later. Eventually Jay learns that it's the police he's fighting and not his neighbor and his neighbor's friends. So he drops, the knife, he gets down on the ground, and he goes to jail. In jail, because he had been in a fight with the police, what do the guards do? They do not like him at all, right? There's no mercy and no pity for him. He isn't allowed to have his cane because it could be a weapon, so he can't orient himself. He's in a cell with a lot of people. He has no way to protect his food, right? He has no way to protect himself. So then he gets put in solitary confinement, and it just goes on and on. He ends up staying in the jail waiting for his trial for 2 years because he will not plead, he will not accept that he did something wrong. Yeah, and they set his bail very high, so he can't buy his way out. He does have his trial. He's found to be innocent. There's footage, on the camera that the police had, and so he's out now. But the point is that at every stage of the story, he went unprotected, right? And so he was encountering the police and going unprotected, whether he was in his home or in the jail. And he is someone who appreciates the police. He's someone who appreciates the system. He's a veteran. When he tells the story, he tells it with a lot of compassion, but also an awareness that he was very, very much harmed, right, by these institutions the whole way through. So we live in a world where I tell this story, and a lot of people in this room kind of know what's going to happen as I tell it, right? And who, just kind of go, yeah, here it goes, because some of us have seen this happen to people that we know, and some of us have read or seen news stories that are like this, or ones that have even worse consequences, right? So we live in this world where police contact and jail are thought to resolve personal crises or help with social conflicts, but often don't, often make those crises and conflicts much worse, right, than they need to be. More and more problems that have to do with economic inequality, mental health, social conflict, personal crises are often offloaded on the police, so people don't have another solution like you have worked out of the communities that you can call on, right? And so when something goes wrong, the police are the solution for more and more people, with more and more problems. I read the statistic recently that in the nation of Canada, 80% of all calls that the police respond to, so the people call 911 and the police are the ones who go instead of the ambulance, 80% of those calls are for mental health issues, drug overdoses, suicides, or domestic disputes, right? And those are all, none of those are the kind of crises where there's a crime that needs accountability, right? Or where there's harm that needs accountability. Those are all crises that need a response, but not the response of jail, right? So this happens though because a lot of these problems, mental health, substance use, those are problems that people basically just don't want to see in their faces, right? Those are problems that people want to have go away, and we don't know what to do about them, right? And so making the thing a crime or calling someone who does law enforcement feels like the only thing that we can do. And that's part of the reason why police get called. In Jay's case, the police were called just in order to use the police to harass Jay. But, and that's something that happens too. 70% of the people killed, this is another statistic I wrote down, 70% of people killed by police in the past 20 years. I didn't write down if that's in Toronto or Canada.
It's in Toronto.
Had mental health or substance use issues going on when they were called, right? Because my brother-in-law is a police officer, and so I know actually that part of what's going on is the police officer doesn't feel safe, right? And so that's part of what's happening. They're human beings too, but they have a gun, right? So anyway, these problems often have to do with what we might call organized abandonment. And so that's kind of a term, and I don't have it on my definitions page, but this is a term, organized abandonment. And what that means is that there's a lack of support for people or a neighborhood, like a certain social group of people or a certain neighborhood that are not seen as valuable. And there's this lack of support is basically at the institutional level. And it's because this neighborhood or this group of people is not seen as valuable. So a common example that people point to is this area of New York City called the Bronx, where in the 1970s, the city stopped even sending garbage trucks to take away the waste, right? So that neighborhood was being abandoned, right? And often enough, when a neighborhood is being abandoned, the only institution that is supporting in that neighborhood, or the most supportive institution in that neighborhood, will end up being the police, right? And that's not, and that, so then it becomes this either or, like either we're totally abandoned or we have the police to call on, right? And so that becomes a trap also, right? This idea of like, either we have no support or we have the police as support. So that's part of the issue. So the system of police and prisons is often understood to be in place in order to hold people accountable when they do something harmful, right? But on the other hand, there's very little accountability when the police, jail, or prison systems do something harmful. So that's another problem. When we're thinking about how to manage situations where it's not just an accident, you know, it's not like a fire in the building or some boxes falling on your back, but there's something harmful happening and it's unsafe, but we're not sure if this is the right moment to call the police, or we're not sure that we like to call the police, or we're not sure if that's safe to do that. What do we do? And we can't just stop calling the police today because we're not ready, right? So this is, I'm passed out this set of resources here, and you have to have your magnifying glass with you. Yes. And I'm so sorry I didn't bring magnifying glasses. But this is just for you to take home and read with your magnifying glass. So this is a list of resources that exist here in Toronto, and it was put together by Regent Park resident named Mushafika Chowdhury. I know her as Mo. And so this is existing resources that you can go to when there's something, a crisis or something harmful, and it doesn't seem like it's safe to involve police. I'm not going to go over this with you. It's just for you to explore. The other handout here is what we're going to start working with right now. And I'm on this not this side, but this side here with all the text on it. Sorry? She made this, it says 2023, but I think it was like in the April or March. Yeah. So what we have here is a list of models. I would say models. They're kind of ways of thinking about how to create safety. And these are like big thinking models and practices that people are trying on in all over North America and other places as well. And I just want to make you aware of these. I'm not saying this is something that you have to like start doing today, because I'm just making you aware of these models. So the first one is harm reduction. And this is, who here's heard of harm reduction? Yeah. And because you work in houselessness and you've heard of it, yeah. So I have here this definition of it that I adapted from the Canadian Observatory on Homelessness. Harm reduction is an approach or strategy aimed at reducing the risks and harmful effects associated with substance use and addictive behaviors for the individual, the community, and the society as a whole. It's deemed realistic, pragmatic, humane, and successful to address issues of substance use with harm reduction. Recognizing that abstinence may be neither a realistic or a desirable goal for some users, especially in the short term, the use of substances is accepted as a fact under this model. And the main focus is placed on reducing harm while substance use continues. So for example, if you are taking the approach of harm reduction, and you're encountering someone who is exhibiting some messed up behaviors, right? But it's connected to substance use. One reaction that like a social worker, I guess, could take would be to say, like, I'm not going to help you unless you stop using, you stop drinking alcohol, or you stop using fentanyl, or whatever it is, right? And the idea is, like, you're never going to actually get them to comply with that. So you're never going to actually, like, reduce those other behaviors that are messed up and that are creating harm, right? Or you're never going to be able to help them improve their lives if you make it all contingent on them, stopping their addiction, right? Or complying with whatever it is. Sometimes it's not about substance use, but sometimes it's just about, like, getting someone to comply with taking their psych meds, right? Or something else, right? So the idea of harm reduction is a lens that says, I don't need to fix this individual, right? I think I see the root of their problem, it's substance use, but I don't need to fix that, right? What I need to do is reduce risks and harms around them, right? So let them have some housing, put them in some housing, and not make it be contingent on, they stop using substances. So that's one really important model for creating safety that exists and that's out there and that we can learn more about and invest in. And you all are community leaders, so that's why I'm, just putting this out here for you, even if it doesn't exactly apply in your work. It's good for you to know about this. The next model that's on here is transformative justice, okay? And it's also related to something else called restorative justice. And so transformative justice and restorative justice are models for holding someone accountable without going through the courts and the jails, and the prison system. So what we have here on this page here is transformative justice, which is a framework and approach for responding to violence, harm, and abuse. And it's really, the people who are working out this concept are working especially in the area of sexual violence and sexual abuse. So this is a model that's used to deal with rape, right? And also with the molestation of children and very harmful, things that are real and very harmful. At its most basic, this model seeks to respond to violence without creating more violence, and or engaging in harm reduction to lessen the violence. Transformative justice can be thought of as a way of making things right, getting in, quote, right relation, or creating justice together. So transformative justice responses and interventions, one, do not rely on the state, so do not rely on police, prisons, or the criminal legal system, the foster care system, immigration system. They do not reinforce or perpetuate violence, such as oppressive norms, vigilantism. So that means that, they're against racism and they're against sexism. And most importantly, number 3, transformative justice cultivates the things we know prevent harm. So it's about creating healing, creating accountability, resilience, and safety for all involved. And that's the definition. What's not written on the page is the way this works is people basically identify when a harmful situation or relationship or event has happened, and they form teams. One of those teams surrounds the person who was harmed, right? And then another team surrounds the person who did the harm. And these teams are assembled together to make sure that the person who was harmed is getting what that person needs, right? In order to heal, in order to be able to move forward and move on. And then the person who's surrounding the individual who did the harm is working on making sure that that person understands, how harmful it was. Make sure that they're getting basically like re-educated to understand the violence of their behavior and hold them accountable to make amends, make restitution, or do what it is that the person who was harmed needs. So for example, if they live in the same building and the person who was harmed is feeling traumatized, either pay for that person to move somewhere else or you move, like, and that, you know, and so the person who's being surrounded, yeah, so whatever that is specific to that case though. The last one that I'm going to go over here is called mutual aid. And I wonder if people have heard of that, mutual aid, maybe especially during the COVID-19 pandemic. That was a big deal. A friend of mine, Dean Spade, wrote a book called Mutual Aid, and it became really famous. It came out in 2020, and it became very famous. It was like very good timing that happened. So what mutual aid is, according to Dean Spade, is the collective coordination to meet each other's needs, usually stemming from an awareness that the systems we have in place are not going to meet them. So we can't just rely on the city or the state or the province or the, you know, the government to meet our needs. So those systems, in fact, have often created the crisis or are making things worse. We see examples of mutual aid in every single social movement, whether it's people raising money for workers on strike or setting up carpools during the bus boycott or putting drinking water in the desert for migrants who are crossing borders. A lot of activism, social activism involves doing mutual aid. So the direct, anytime that we're directly meeting people's survival needs, based on the shared understanding that the conditions in which we are living in are unjust and we have to take care of one another, that is what doing mutual aid is. And so I think a lot of what I heard people talk about when they talked about what makes them feel safe, you know, and knowing the people around you and knowing that they can help you fulfill your needs and you can help them is part of mutual aid. Did any of you take part in mutual aid during the COVID-19 pandemic? Yeah, 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 okay. So those are the big models that are kind of circulating and have a lot of, I would say, clout, you know, right now in this world of like, how do we create safety? But there's also just a lot of little things that you already do and you already know about that aren't a big model. So I put these 3 buckets here up on the board. One is, what do you do to prevent harmful things from happening? What do you do to hold people accountable for harm? Perhaps without, and we're talking about the things we do without calling for people with guns in big cars to come help us. And then how are you expanding your skills, resources, and readiness to deal with problems that come up? I was going to do this as a brainstorm. Yeah, but the other thing we could do actually is we do have these Post-it notes. So we could have you write stuff down and then we could post it up. That could be fun, right? So we'll make, this will be the orange bucket, this will be the pink bucket, and this will be the green bucket. Okay. All right, and I'll pass out some Post-its, and can you also pass them out? Yep, thank you. You're welcome. Okay. She'll get it. Okay. So we have a lot of your ideas because obviously you all know a lot about how things work for you. So some of the things that I'm seeing here under preventing harmful things from happening are creating group norms and expectations on behavior and treatment. So that's a proactive thing to do. More support centers and options for seeking support. I see up here community education, safety training, reducing harm or violence by more workshops, so that's more education, youth programs. I think that some of the things that I don't see up here but might also belong up here would be things like housing, food banks, making sure people's basic needs are met, and how important that is for any community safety. Like when people don't have their basic needs met, they can do really messed up things, right? So that's a baseline way of preventing harmful things from happening. I've even seen universal basic income be something that people will put up here when they're thinking about how to prevent harmful things from happening. Yeah, and getting to kind of the root causes underneath why people will do harmful things, right? And so that's, anytime we're doing that, we're helping to create community safety, and doing that in a way that's not calling on people with guns to come into our neighborhood to like do something to make an intervention, right? So just trying to have a safe space where we don't even need to introduce violence to counteract violence. It says being prepared, listening to others, trust your instincts, and steer clear of things that make you feel unsafe. So yeah, taking ownership of your own safety and like keeping yourself safe is part of it too. Sometimes I've seen things like having better street lamps up, good street lighting, keeping the parks, activated and cleaned up so that they're places that people will want to go to and recreate instead of places where dangerous things start happening is also part of that. Okay, this one was the one where everybody was like, what? What do you mean? How do we hold people accountable? I see a lot of things here that are just talk to people who've done the harm about it, spread awareness, speak up. So that's part of it. Sometimes it depends on what the situation is, though. Like if you talk to somebody, you might be putting yourself in harm's way. Yeah. Again, my neighborhood is a little wild. And so I've, definitely gone into the park and seen people, fighting each other. And I'm not going to go in there and like hold them accountable to the harm that they're, doing on each other. Yeah. I see community work, therapy, counseling. So that would be, if somebody is doing something that's harmful, like they need help. So having those resources available for people, even just people who have mental health issues and who have substance abuse issues, those people tend to be people who are going to do harmful things because they're not in our shared reality, right? So, and it's not because they're bad people, but they're not in our shared reality. So that kind of support is important. Nobody wrote up here transformative justice and restorative justice, but that's what this bucket is really, is developing systems and ways for working with people who've done harmful things, and also for working with people who've been harmed so that they can identify what justice would look like to them. And yet also it is the case that all of us know people in our lives who've done harmful things, and we can see ways to support those people or try to support those people to go through a healing process so that they will stop doing harmful things or stop doing as many, reduce the harm, right? That they do, right? So we can apply that at least in small ways, even if we don't among ourselves have a skill to deal with someone who's like hurting someone else without calling on the criminal punishment system. Yeah. Like if you know a child is being abused, you don't want to not call the police just because, you went to this workshop, like you still have to like do something about it, right? But it's about expanding our skills to find ways to do healing work and like find restoration in more and more cases of this that we see in our community. But if you know, like, there is a situation, here's something, if you know there's a situation where this is, again, my life, there is a place where people park their bikes outside my building, and there are bike thieves that go there all the time to try to steal bikes, and that's harmful, right? And I mean, the way that we address it is we have started to store our bikes in different ways, I guess. Instead of one thing you could do is put cameras on it and call the police every time it's happening. And there are people in the building who do want to do that. The people who are stealing the bikes because they need the money to buy fentanyl, right? Or buy meth. They're not stealing it because they want to hurt us, And putting them in jail for stealing a bike doesn't stop them from stealing a bike 2 weeks later, right? So it's not actually doing anything to reduce the amount of harm that's happening, right? But we can do other things to try to protect our bikes. So expand your skills, resources, and readiness to deal with problems. People wrote having educational resources accessible and available, having medical trainings for residents. So medical trainings maybe in what to do, maybe CPR, maybe naloxone, other things. Keep yourself up to date with news and alerts so you can be aware. Enroll in self-defense classes. That's a big one. You have conflict resolution class up here. There's de-escalation trainings also, which is not conflict resolution, but it's just how to calm someone down instead of, escalating them up. Find and look for similar situation. I'm not sure what I know what that means. Training programs, safety, mental health, conflict resolution, stop bleed. Yeah. Expand your skills and resources on restorative justice by speaking about it. I'm going to put that one over here. So there are solutions. That's another thing. Even beyond what this community is, there are solutions that people are building, but they're not invested in. So there are solutions like this system called peer respite. And just peer support. I don't know if people have heard of that. I'm sure you have. Yeah, but peer support is...
I'm a peer support.
There you go. Great. Yeah. Do you want to say what that is?
You finish.
Okay. Yeah, because peer support is where someone who's been through it becomes the worker who is mentoring the person who is going through it now and supporting them. Not by telling them I need to fix you, you need to do this, you need to do that, but just by saying hey, I will walk with you through this. And peer support started in the world of substance use, but it's transcended into other areas of mental health. So peer support for people who have schizophrenic or other psychotic disorders or conditions, I should say, who don't live in our shared reality. Peer support for people who have bipolar or depression or severe anxiety. There are peer support workers who run houses called peer respite centers where people can go if they feel like they're going into a crisis so that they can go be in the peer respite center instead of getting put into involuntary confinement, which can be very, very a very traumatizing process to go through. Yeah. And I just want to say, we only have a couple minutes left, and I just want to say, and we will get to you, but I want to say we don't have time for this activity, but this is meant to sort of replace the vague idea of community, right? Which is because when somebody say community, it's just well, what does that frickin' mean? That means nothing and everything, right? So the idea here, and this comes from the organization Bay Area Transformative Justice Collective, is to not think about who your community is, but think about who your pod is. Who are the actual people and what can they actually why do you actually need them, right? Like what can they support you with and what can you support them with? So the idea is you're the gray circle in the middle, and then the dark black circles are the people who are your pod, and maybe it's more than 6 or maybe it's like only 5 or whatever, but you would fill out like who those people are, who you know you can call on, and what can and why, right? And then the dotted line ones are the people who, you know, maybe they actually could be part of your pod if you talk to them about it and you like make a plan with them, like their potentials, you know? And then these would be the actual institutions and resources, community organizations that you can trust to call on also. And the idea is that in order to create safety in community is too vague of a notion, but we can actually be specific and concrete about it, and we actually all do have the ability to fill this out. We are a talkative group, so we do not have time to finish doing this, but I'm going to give this to you as a tool, and I'll have Kayla and Aditi send out the instructions if you want to do it on your own. Connie, do you want?
Yeah, I want to say something.
Yeah.
If you, even you have an education,
Yeah.
training or skill, but if you are not have a big heart or showing your love and concern
Yeah.
to the person who has need something help, so you have to have concern to the person that you have to meet.
Yes. Yeah, that's very true. Yeah. Okay. Yeah, I think we can wrap it up there because it's time. I appreciate all of you, and I've really enjoyed learning from all of you tonight. So thank you so much. Yeah.
Thank you so much for watching. Don't forget to like, comment, share, and subscribe to our YouTube channel. Also follow us on social media, and for more information, check out our website.